everyone. How are you? My name is Diane Keller. I'm the President and CEO of the Ann Arbor-Ypsilanti Regional Chamber. Thank you so much for joining us here today. I would like to thank everyone who is joining us on this virtual luncheon, and we wish to especially thank our members. Your dues enable us to enhance our programming and the businesses at large in our community. So a big thank you and for all of your continued support of the A2Y Chamber. Before we get started on our program today, I just want to give you the agenda. So I will first introduce our speakers. After they have concluded their presentations at approximately about 12:45, we'll have some Q&A and we will wrap it up at 1 p.m. A number of you have sent in questions in advance, and we will pose those questions during the Q&A. However, if you have additional questions, please put them in the chat box, and if time permits, we'll ask those questions as well. So now, let's get us started. I would like to first start by thanking our host, St. Joseph Mercy Ann Arbor, just for a variety of reasons. First, their partnership and amazing commitment to our community and the sacrifices that both the hospital and the staff have made to assist us during this pandemic. As most of you know, some have put their lives at risk and some have been furloughed to help others that are in greater need. So for really, on behalf of all of us, for your sacrifices and your continued commitment to our business community, our sincerest appreciation. Second, this is called the virtual luncheon. And as such, each of you will be receiving a restaurant gift card today, compliments of St. Joe's to help support our local businesses in our community. So we thank you very much for that as well. Our local businesses, certainly you have done an amazing job supporting our community in a variety of ways, and this is just one more example. And last but not least, we are pleased to have with us two very special experts at St. Joseph Mercy Ann Arbor. Our first presenter is the new president of St. Joseph Mercy Ann Arbor and Livingston, Alonzo Lewis. President Lewis will share his story, his vision, and provide a firsthand update on how St. Joe's is emerging from the COVID-19 crisis and what they are doing to address the social needs in our community. And then after his presentation, you will hear from our Chief Medical Officer, Dr. David Vandenberg. He will be on hand to answer questions and deliver the latest updates on healthcare so that you can feel confident that you can seek the medical care that you need for your family. So let me tell you a little bit about both of our presenters today, and then we will get started. Alonzo Lewis is the new president of the St. Joseph Mercy Ann Arbor in Livingston, where he has been promoted from the position of Chief Operating Officer. Prior to joining St. Joe as Senior Vice President of Operations in 2016, Lewis was Vice President of Women and Children's Services and Business Development of Beaumont Hospital in Royal Oak. He also earned both his bachelor's degree in sociology and his master's of health and service administration from the University of Michigan. Go Blue! And as a longtime Ann Arbor resident, more than 20 years, Lewis is involved in numerous community organizations, including serving on the board of the Washington Health Plan, the Glacier Hill Living Center, and Hope Clinic. So before I turn it over to Dr. Lewis, let me introduce to you Dr. David Vandenberg. Dr. Vandenberg is the Chief Medical Officer at St. Joseph Mercy Ann Arbor with 28 years of inpatient care experience. He has been with St. Joe for nearly 20 years, and last year he won the prestigious Hospitalist of the Year Award from the Society of Hospital Medicine in the Michigan chapter. Dr. Vandenberg was also a medical director of clinical outcomes at St. Joseph Mercy and received his medical education from Wayne State University School of Medicine. So President Lewis, and Dr. Vandenberg, thank you so much for joining us here today. I will turn it over to you, log myself off for a few minutes, and then we will return later, and I will handle the Q&A with you.
Sounds great. Thank you, Diane. It's an honor to be with you today. Dr. Vandenberg and I are happy to kind of talk with you a little bit more about the journey that we've been on over the last few months, and also what we're doing to ensure that the community feels safe with the services that we continue to provide to our community. Let me just start by making a few opening comments. I've got a few goals that I'm going to share with the group. Our team is in the process of actually formulating a more longer term strategy and vision for the organization. But given some of the challenges we've been faced with in 2020, all of our plans, quite frankly, are very near term and quarterly focused, given our response to the pandemic. But it's an honor to be before you today. I'm happy to be serving as president of Ann Arbor and Livingston Hospitals. The Ann Arbor campus is about a 548-bed community hospital. We started in downtown Ann Arbor, but Sister Evangelise actually had the vision to relocate the hospital from the Ann Arbor area out here to Superior Township. We sit on 340 acres of beautiful land. It's not many hospital leaders across the country can say that their 500-bed hospital sits on 340 acres. So we are fortunate and blessed to have the footprint that we have, and we use it to contribute to our healing mission. Our hospital is certainly part of a regional health system. So we're organized under an 8-hospital health region called Trinity Health of Michigan. And Trinity Health of Michigan is actually a wholly owned subsidiary of Trinity Health and based out of Livonia, Michigan. Trinity Health is one of the largest Catholic health institutions, comprised of more than 90 hospitals across the United States of America, and generating about $19 billion in revenue. So we've got a large health system that certainly was an advantage for us as we fought the pandemic these last few months. Our footprint certainly extends beyond the Ann Arbor area. We have our Livingston and Brighton hospitals and health center. Our Brighton Health Center is what we would consider a big box outpatient healthcare setting that certainly has physician offices, but it also has a 24-hour freestanding emergency department. We've got a number of ORs and procedural rooms there, and a 23-hour short stay unit. So huge investment for us to be in the Brighton Livingston area as well. And then last but not least, we our Integrated Health Associates, IHA, is our physician organization that's closely aligned with us, as well as the Huron Valley Physicians Organization. So we strategically invest in our physician relationships to collaborate to grow our programs and services in our community. If you can move on to the next slide for me, and you can move past that one, that'd be great. As Diane mentioned, I joined St. Joe's back in 2016. I served in the capacity of Senior Vice President of Operations. I expanded my responsibility to Chief Operating Officer. And actually, in mid-March is when I assumed the role of president for both hospitals. And we consciously chose not to announce anything, given that all of our communication and attention was placed on fighting the pandemic. So I'm appreciative that the message is now out in the community. And thank you for those of you that have sent me congratulatory notes and messages. I'm grateful to serve. In addition to, my role as the leader here, it's really important for us to be connected, with many community organizations. I serve on the board of the Washington Health Plan, which is a small health plan in Washington County that kind of fills the gap for those folks in our community that maybe make a little bit too much money to qualify for Medicaid, but also don't have, an employer-based insurance plan that covers their total needs. So Washington Health Plan kind of fills that gap. It's an honor to serve there. My career started in older adult services back in the early 90s. So it was an honor to come to St. Joe Ann Arbor and to be asked to join our sister senior living community called Glacier Hills. Glacier Hills is part of our Trinity Health organization. It provides the full continuum of care for older adults, from independent living to assisted living to skilled nursing and rehab. So, and we do a lot of programming and work together to better serve the older community. Then last but not least, I also serve on the board of the Hope Clinic. The Hope Clinic is it's a neat little place in downtown Ypsilanti. They're committed to providing free care to anybody in need. And the Hope Clinic defines care certainly as providing medical, dental, and mental health services, but there's a tremendous spiritual footprint to the work that they provide. So they provide prayer to all the people that they come in contact with too. So if you haven't paid a visit to the Hope Clinic, I would encourage you just to spend a little bit of time there seeing that special place. So it's an honor to serve there as well. Last but not least, before I get into some of my goals, as Diane mentioned, I've been in the community for over 20 years. My beautiful wife and I have 4 children. We've got a 16-year-old at home, 2 9-year-olds, and a 4-year-old. 2 of those 4 kids participate or are educated by our Ann Arbor public school system, so I'm very proud of that. And any discretionary time that I might have outside of this job is totally consumed with travel, baseball, and travel soccer commitments. So I may run into many of you, certainly at a few restaurants downtown, but likely on a soccer field or a baseball diamond. So I love that aspect of what I do, and it's an honor to actually be able to work and socialize in the Ann Arbor community. So if you go to the next slide. Just a little bit about, the goals. One of the ahas that I believe I got as we were fighting this pandemic is how we have a tremendous opportunity to better connect with our community. Our mission statement calls us to be a transforming, healing presence in the communities that we serve. And we cannot be that transforming, healing presence if we don't have a good understanding of what our community wants and needs from us. So one of my goals is to be able to strategically and intentionally connect with various folks in our community. And I kind of summarize them into maybe 3 buckets. The first would certainly be small business within the Ann Arbor community. Want to better understand how we can collaborate and meet the needs of small business and also colleagues within those small businesses. 2, we've got at-risk, communities, and that was made evident through how the COVID-19 pandemic impacted certain folks in some of our surrounding areas. Want our group and our leadership team to think about how we can better get ahead of that and be a better partner with the community such that we can better respond and try to mitigate some of the impact that's happened over the COVID-19 situation. And then last but not least, there are numerous community groups and organizations in our community that I want to open lines of communication with such that we hear firsthand the voice of our consumer and our patient population. And then we can actually better think about how we work on our patient experience and how we develop programs and services to ensure that we're fulfilling upon our mission, which is a transforming, healing presence. Hospitals such as ours, we can kind of comb through all sorts of patient satisfaction surveys and other data to better understand what the community needs, and we'll continue to do that. But I want us and our team to be incredibly intentional about getting out in the community and pressing the flesh and establishing those relationships. So we're only a one phone call away when someone in the community needs something from St. Joe's. So interested in strengthening those relationships with the community such that we can be that transforming, healing presence. Next slide. This isn't just a little bit about what we are doing in our community. As I've mentioned previously, the pandemic, gave us an opportunity to do more in the community, and we responded in collaboration with our Washtenaw County Health Department by setting up some pop-up testing sites within the community. We've tested numerous patients within skilled nursing facilities, but we also partner with the Delanish Shelter and tested folks who are at risk or within some other community organizations. So we were able to proactively get out and screen and test more than 300 people in our community. And the good thing about the outcome of that is that we found that there wasn't a lot of incidents within those folks that we tested. So I think the homeless shelters and some of our nursing homes did do a good job of social distancing and isolating folks where possible to control the spread of the pandemic. Food, if any of you kind of look at some of those social determinants of health, food is one of those priority areas that determines how well a person may do over time from a sickness and disease point of view. So when this pandemic hit, folks were forced to obviously stay at home, and those folks that didn't have means for transportation or didn't have family members to maybe help out were impacted negatively from a food perspective. So we responded pretty quickly to develop a 6-week program where we established a food box delivery program in support of Hope Clinic and Jewish Family Services. We also were able to secure a $10,000 grant from the Children's Foundation to partner with Growing Hope and some other local farmers to establish an online grocery for fresh fruits and vegetables. And we were able to deliver those to certain homes as well. And that in and of itself, was able to transition $30,000 of revenue back to small farmers in the Ypsilanti community. So we're very proud of our ability to quickly turn on an online market and move product, to communities at risk. And one other thing I want to mention is this $410,000 grant we received from the Michigan Health Endowment Fund to launch Nutrition Buddies. And this Nutrition Buddies it's a really unique program that's targeted to teach teenagers about the value of nutritional meals. And we're going to do that in collaboration with the farm here at St. Joe's. So not many hospital administrators can say that they sit on 340 acres, and not many hospital administrators can actually say that they use some of their acreage to actually have a true farm where we're growing produce and we're able to distribute that to the community. So another proud moment for our organization. Next slide. The pandemic certainly impacted people's ability to get food, but it certainly also had broader impact than that. We, through our community health and well-being department of our organization, we set up a hotline for anybody that needed help related to the COVID pandemic. And if you dialed this number, one of our staff members would actually answer the phone, triage a social need, and connect them in the community with the appropriate resource. So again, we've been able to do some great things in a short period of time within our organization, but I'm looking forward to actually doing more over time once we get past this pandemic. Next slide. The next goal I'll talk about is just the importance of us emerging, from the pandemic. And successfully emerging is probably the better word to actually use. Many of you have probably read about the impact that the pandemic has had on hospitals and health systems. Certainly has challenged us financially. During the middle of the pandemic, we were forced to stop and pause and postpone many of our surgical and diagnostic treatment services in an effort to preserve personal protective equipment and to limit traffic within our institutions. That had a pretty dramatic impact on our income statement, and it literally turned, what was a well-functioning hospital with a margin quickly into a hospital that was struggling to make money. We'd certainly received some CARES Act dollars from the federal government, and that certainly has helped. But it's actually bringing a lot of that elective and diagnostic program and service back online that will drive us back to a sustainable place. So I am excited to mention that we have almost every program or service back online. And if it's not online, we've got some plans to bring it back online later in the month of July. But the pandemic certainly challenged us from a revenue and an expense perspective. One of the things I'll mention, from a personal protective equipment perspective, is that we certainly had our challenges with some of that elective activity that we weren't able to perform, which generates, good revenue for a hospital like ours. But also the cost of the personal protective equipment, brought challenges in and of itself. Many of you are aware that there was a national or global shortage of a lot of that equipment, and those that were able to produce it and supply it actually were able to charge whatever they wanted, because all of organizations such as ours were in tremendous need for those things. So the one example that I like to use is the simple factoid that one of those N95 masks that we used and we continue to use cost the organization 50 cents a mask prior to the pandemic. And once the pandemic hit and demand increased for those masks, the shortage of supply was there. We were then charged $8.50 per mask. So that one mask went from 50 cents to $8.50 a unit. And we were actually, kind of burning. Our burn rate for a lot of that PPE was pretty high. So the expense of the PPE coupled with a lot of our revenue generating activities kind of created a tremendous amount of imbalance in our income statement. So what we've learned from all of that is going forward, if there is a second surge, I think the state has done a great job of controlling it, but if there is, we've put a lot of programs and policies and procedures in place to instill in our colleagues, our physicians, and our community that we will have the ability to coexist with COVID in the event that we get a second surge. And Dr. Vandenberg will go into a lot of detail in terms of what some of those mitigating circumstances would be and how we'll manage through that. But I'm excited to say that we feel well positioned to succeed in the event that a second surge does come our way. The next goal that I'll talk about is the patient experience. The pandemic certainly challenged, the experience that we were accustomed to providing our patients and families. Many of you know that there were certain executive orders that minimized who could come into a hospital and visit a loved one or a family member. There were very few extenuating circumstances by which we allowed that. So oftentimes, as we were treating patients, unfortunately, there were certain instances where, there were expirations of certain patients and loved ones could not be nearby. So that was certainly a stressful situation for the patient, a stressful situation for that patient's family, and an incredibly stressful situation for our physicians, nurses, and other caregivers. That in and of itself is totally against, the culture of our organization and how we deliver care here and what it means to be a transforming, healing presence. So we've got to recover from that, quite frankly. So we're putting a lot of effort and energy into improving our patient experience. It's how we meet and greet patients, for diagnostic procedures, how we care for patients when they're in an inpatient bed, how we explain treatment plans and care modalities or medications, and then how do our support systems, such as the cleanliness of the room or even our food and nutrition services, how do those support services actually enhance the overall patient experience? So we're getting back to the basics such that we can accelerate our efforts to improve upon our patient experience. And we've got a lot of attention and leadership focus on that in and of itself. Two other things that I'll talk about, which are not necessarily on this slide, are growth. Once we reestablish ourselves and stabilize following the pandemic, we've got a number of growth strategies that are service line and programmatic in nature. I can't get into the specifics of them, but I can tell you that they will leverage upon our capabilities in oncology, cardiology, and neurosciences. Those three service lines are going to be pretty critical for our growth over time. So we're excited about what we kind of have coming together there. And then last but not least would be just intentional focus on our culture. You know, the culture of an organization drives a lot of what we do and how we do it. It's how we interact with one another. It's how our senior leadership team leads, and it's how we engage with our patients and families. So our leadership team is spending a lot of time talking about what is required to create an inclusive culture, given everything that's going on in our community right now, but also an inclusive culture that strives for excellence in speed to execution and outcomes. So a lot of attention being placed on improving our culture. The next slide, I'm going to fly through some of this stuff because I think many of you have kind of stayed up to date on what some of these facts and figures are related to the pandemic. They've been reported out on radio stations and news outlets, etc. So I'm just going to fly through these really quickly. You know, as of the 21st of June, there were over 61,000 confirmed cases, over 5,800 COVID-19 deaths. And as of the 21st, there were another 146 new cases and 3 COVID deaths. So the numbers continue to increase slightly, but I feel like we've got pretty good control right now over the pandemic, given all of the things that our governor put in place to stop the spread. Next slide. You can see on a day-by-day basis that, and I'll show you another graph later that shows where we peaked, but you know, the daily cases in the state of Michigan peaked in early to mid-April, and we bent the curve pretty significantly following that. And that curve has been on a strong downward slope since, but we've got a bit of a slight uptick in the last few days, and Dr. Vandenberg will kind of speak to some specifics around that. And then the daily deaths are pretty self-explanatory, so you can go to the next slide. This next slide kind of gives you a bit of an internal overview or a timeline in terms of what we experienced internally. I've kind of alluded to some of this stuff already, but I'll review it with you anyway. On March the 13th, we actually experienced our first inpatient confirmed positive case. And from that point in time, we actually instituted our own incident command and put a bunch of different measures in place to begin to prepare, you know, for an increasing number of cases coming our way. On the 15th, Governor Whitmer restricted all visitors coming to our institution. On or around the 15th and the 16th is when we postponed a lot of that diagnostic and elective surgery work that I mentioned previously. The 23rd, Governor Whitmer instituted the executive order. At that point in time, we sent a large number of our colleagues to work from home. We went through a process of determining what folks were essential to be here on site, and if you weren't required to be on site to provide or support patient care and you could do your job remotely, we encourage folks to actually remote work from home. On the 26th, we instituted our drive-through testing process for those folks in the community that had an interest in knowing whether or not they were positive. If you were symptomatic colleagues, we sent folks through our testing center. And we also participated in establishing some testing capability for Wayne County at the state fairgrounds. And that was done in collaboration with 2 other large health systems in southeastern Michigan. Then as you can see, on March 31st, we went from 1 positive case on the 13th to 105 either confirmed or suspected COVID cases by the end of March. So the volume of COVID cases ramped up pretty quickly, and that required us to develop a lot of surge plans to support that increase in census. If you can go to the next slide. You can see, 15 days later, we hit our peak. So the state of Michigan had around 28,000 confirmed cases. We got to 121 confirmed, plus another 56 suspected cases. We contained all of those patients on a number of units, such that we could actually keep those patients that still required acute care services on separate units in our hospital. So you can see that on or around the 15th, we had, close to 180 patients, either who were diagnosed or suspected to actually have COVID-19. As the previous slide indicated, where the number of new diagnoses in the state of Michigan took a precipitous decline, our numbers began to decline. Also, we then went back into what we would call recovery mode, and this was a lot of planning went into how we were going to bring back online a lot of our programs and services that we actually had postponed. So in early May, we actually began to do surgery cases in our outpatient surgery center, and our partner physician organizations reopened their offices to see patients face to face. Dr. Vandenberg will talk a little bit about the role that telemedicine played, during that period by which we limited, patient and doctor contact using telemedicine. On the 18th, we reopened our cancer centers and began to distribute many of our cancer patients closer to home. We continued to provide cancer treatment. We just kind of collapsed that to 1 or 2 different sites. But around May 18th, we felt comfortable redistributing that work closer to where patients live. So we reopened our cancer center there. And then if you look at that last data point, June 22nd, which was just a few days ago, we had 4 confirmed cases in-house with another 2 positive. So the number of patients sitting inside the 4 walls of our institution has certainly declined. But we also realize that we're going to probably maintain some small census while we get back to some semblance of normal operation. Next slide, please. Through the pandemic, there was just a tremendous outpour of community support. I mentioned us kind of establishing what we called our incident command center. This was kind of our central point that managed how we would respond to the pandemic internally. But we also, within that incident command center, we established a process, a telephone number, and a team to actually respond to the outpour of support. We set up a donation number and a donation center to actually just receive the numerous donations that we were receiving, on a day-to-day basis. The total dollars across Southeast Michigan was about $1.8 million of either donated support or true cash in kind support to help us respond to the pandemic. And that $1.8 million is spread across more than 900, people or organizations. Our largest donation that we received was a $150,000 cash donation. But within that $1.8 million, there were, as I said, monetary gifts. We had personal protective equipment being donated by dental offices. We had N95 masks donated from construction companies. We had all sorts of supplies coming our way. And there literally was not one day within our organization that there wasn't a meal coming our way to support staff caring for patients. Literally, I can tell you that it brought tears to many people's eyes just to see the tremendous amount of support that came our way. If you go to the next slide. Here are just a few pictures that just kind of illuminate, what I mentioned. Big George's donated 40 flat screen TVs, and those came in incredibly handy because we have a building on our campus that, as part of our surge planning, we actually plan to bring that building on as an alternate care site for folks that didn't have a safe discharge home but didn't require the needs of acute care anymore. So we actually created a respite site within our Towsley Health Building, and we outfitted each of the rooms within Towsley with one of those flat screen TVs. So we were ready to go with providing a comfortable environment for patients that needed some respite care but couldn't necessarily function independently in their home. The picture on the right is an example of 350 meals, I think it was, that was funded through a GoFundMe page that enabled Zingerman's to actually provide those 350 meals to our off-shift or night shift colleagues. And that's a picture of our Probility physical therapy leadership actually working with Zingerman's to actually distribute those meals to our colleagues and staff. So a tremendous thank you to the folks that donated to GoFundMe and then to Zingerman's for actually donating those meals to us. Next slide. These are a few other ways in which the organization felt incredibly supported throughout the pandemic. So the picture on the right is Fantasy Lighting of Belleville, who projected messages of support and appreciation on the exterior walls of our hospitals. And we had numerous colleagues actually come out and participate in that event. The middle slide is not just a picture of one of my favorite cars, but literally there's a local Corvette club that did a tribute drive honoring colleagues and healthcare workers. They failed to leave one of those behind for me, but it was nice to see those cool cars actually driving, around our hospital campus. And then on the picture on the right is our Washington County Fire Department, which kind of had a fire engine fire truck parade that actually drove through our ED. And that group of folks said thank you to our ED colleagues for all the work that they provided to support response to the pandemic. So that's a lot. But again, this is kind of just a snapshot in time of what we've been focused on over these last 3 months, but also what we're going to be focused on over the next 4 months. And I look forward to coming back and re-engaging with this group over other strategic opportunities for growth and collaboration as we better serve the needs of our community. With that, I'm going to ask my Chief Medical Officer to kind of take it away from here. You're on mute, Dave.
You'd think I'd have figured that one out by now. We're getting used to video conference more and more. I thought I was a little bit not such a rookie, but sorry. You guys can probably all imagine how the rest of the leadership team, how thrilled we were when Alonzo was named president. His leadership in the last few years as Chief Operating Officer really came in handy, and we're just thrilled to have him leading us. As Alonzo said, I'm the Chief Medical Officer. I'm kind of new to this job as well, named last summer. I'm an internal medicine specialist. I'm a hospitalist. That means I do all hospital-based medicine during my career, which started down at the Detroit Medical Center, and I came out here about 20 years ago. I do have a lot of background in not just hospital care, but operations, clinical operations, and organizing models of care. They were probably clairvoyant when they chose me last summer. I did have a large role playing in the fungal meningitis outbreak. You may remember from 2012 and 13 with the contaminated steroid injections, and perhaps that was some sort of premonition for what was to come this spring. In the meantime, I should also mention that in terms of community involvement, I helped develop and build the Eastern Michigan graduate program for physician assistant studies, and I still serve as the medical director of that program. Next slide. So I just wanted to kind of give a quick overview of some of the my perspective from the COVID pandemic from the St. Joe's viewpoint, and then a little bit of share a little bit of the learnings we've had and how I think maybe it will change healthcare going forward, hopefully for the better. This is a graph of admissions to our hospital, but it's the dates are represented on the days that the patient was actually diagnosed. So many of these patients were diagnosed not on their actual date of admission, but several days before. And then as the natural history of this illness has shown us, that a few days later, folks get sicker and they end up needing ICU or critical care ventilators. And so you can see that our peak was really in late March, early April, in terms of the number of diagnoses. At the same time that our numbers were going up, and these are cumulative admissions, so you can imagine, as Alonzo said, we had upwards of 180 patients in the hospital at one time getting care. At that time, we had a dramatic drop-off in our other volume, and not just elective volume, but actually emergency room volume. People were avoiding the emergency room because they were afraid of getting sick, and that was a bit of a surprise to us. A lot of our surge capacity planning was around being able to take care of both populations of patients, and rapidly it became clear that we were going to be primarily seeing COVID patients. So when we had at our peak of 180 patients, we had about 320 patients total in our hospital. So we didn't overload our capacity, but we definitely started to stretch our capacity for high intensity care, intensive care. Luckily, because of our advanced planning, and because we're a tertiary hospital, we had plans to be able to surge up and manage those patients. We were rapidly able to convert usual hospital bed space to intensive care unit space. We were able to change our staffing models with our physicians and nurses to accommodate a higher acuity of patients. And we had enough ventilators because we could repurpose special transport ventilators and our operating room anesthesia machines. We had a backup of ventilators in case we needed it. We're very blessed that things started to come down, as Alonzo mentioned, fairly rapidly at the end of April, and we never really challenged that surge capacity. You can see at the tail of this, we kind of got down to a point where many days went by without a new admission, or just a few. In the last week, we have seen a few admissions come in. We haven't seen a real pattern yet. There have been a few patients who have had community type illness. In other words, they contracted it out in the community as some of the restrictions have been lightened up. Before that, the tail that you see towards the end of May was primarily patients coming in from congregate settings, like nursing homes in some of our local correctional facilities. Next slide. So you can just kind of keep pushing. Thank you. So right now, just as Alonzo mentioned, we're really almost ramped up completely in terms of our scope of services. We are, and our outpatient visits are ramping back up over 80% of our typical volume. We did start with a phased approach. So when we did start to open up elective surgeries, we prioritized patients who had, while they may have been elective, they were still, they were time sensitive. So patients that had vascular procedures, cancer procedures, other things that they'd been waiting on for a while. we prioritize them first. And so we had to really change our whole surgical schedule to accommodate that. But it has gone quite well. Obviously, we continue to use telemedicine. I'll talk a little bit about that in a second. One of the main points I want to really make, and I think people are starting to get this message, but I can't emphasize it enough because I do hear this in the community. Our emergency departments have been, fully functional from the start. And we developed clever ways of flow of patients so that patients who come in with flu-like illness are separate, have separate entrances, and are managed separately to reduce any kind of risk of transmission of any infectious disease. Early on, we were using these big tents. We realized that with the volume that we're having, we could accommodate that without those tents. And we actually, in retrospect, think that some of that scared people away because it looked pretty intense. Actually, the way we were able to flex up and perform that was something we're really proud of here. Bottom line, we don't want people to delay care. It is clearly safer in the hospital if you're sick. If you need help, you're definitely safer here in the hospital. We have learned so much about how to manage the risks around transmission of COVID-19 that we feel like we're a long way ahead of most other areas, which is what you would expect. And we don't want people to have an unreasonable fear and then get hurt. Next slide. In the terms of the Safe Care for All, you can open up all those bullet points. We as Alonzo mentioned, we had to have a very restrictive visitor policy early on. Some of that was to try to limit exposure and concern for broader exposure both in the hospital and amongst our visitors. But also we had to preserve our equipment and our PPE and our masks. And so it was quite a restrictive visitor policy. Now we have kind of opened that up so that we're allowing a visitor to all patients, and then minors and patients, newborns can have 2 visitors, as well as our mother baby unit. We are still restricting visitors of patients who have COVID who are actively being treated to reduce the risk of transmission. We obviously are requiring for anybody coming in our doors, even in the outpatient areas, we're asking them to wear a face mask and are providing that. We also are screening not just our visitors, but our colleagues and patients with temperature and symptom screening at the time of arrival. Next slide. As Alonzo kind of alluded to, we have established containment areas, and happily I can say that we now are down to just a single part of one unit, which is our unit that was originally dedicated for novel pathogens, special pathogens that we developed in coordination with the CDC during the scare around Ebola several years ago. And so we continue to use that unit as our primary unit for patients, to isolate patients with COVID. And that it doesn't just isolate the patient, but it also allows us to concentrate expertise and equipment in the right places. And we've been very pleased with how that's worked. We're obviously still following the other rules that we're all hearing about: safe social distancing, cleaning surfaces, but moreover, you can go to the next slide. You can see this is a picture of one of our screening entrances. She's not getting her price checked. She's getting her temperature checked with an infrared thermometer. Next. Yeah, so we put up signage and kind of changing our culture a little bit. And I think we're seeing this in other areas, obviously. I'm sure many of your businesses are similar. Next. We developed as Alonzo mentioned, we developed a testing site for patients who are concerned. We have changed our process around that so that now it's we're back to engaging patients' primary physicians, so they need to come with an order for a test, whereas it used to be kind of a drive-up test. But we are able to test the entire community. The other thing that we're spending a lot of time with is testing our patients undergoing elective procedures. So everybody who's going to come in for a procedure that is an invasive procedure or is going to require an overnight stay, including all our emergency patients admitted, are getting tested so we can place them in the correct unit if necessary. The screening site is just kind of adjacent to our main entrance on our main campus. And I'll say, if you haven't visited our campus, you really should. Alonzo said it's big. It's absolutely beautiful, and it's a place where I am really proud of every day I drive here. We obviously, if patients are positive in the screening, then their doctors are engaged and determined, is this a new infection, and do we need to reschedule their procedure? And obviously we take the appropriate precautions regardless. Next slide. So really quickly, I just think some things that we've learned and how things have changed in healthcare, as I was saying, for the better. We really worked hard on simplifying processes around how to access care, and the rise in telemedicine. While it probably seems simple to someone that's not involved in healthcare, it's been complicated, and we needed to find good secure platforms to perform that. And we actually had to have a platform to be able to bill for our services. Amazingly, you may be surprised, insurance companies, Medicare, did not reimburse for telemedicine visits until this crisis. And so I think that's going to change, because we realize how much better we can get access to people who don't have transportation, or just from a convenience status. Obviously, the testing sites, as Alonzo alluded to, we learned a lesson about maintaining an inventory stockpile and a robust supply chain to be able to rapidly move important equipment around. And we've been really happy with our learnings about that. We've been rapidly able to kind of adjust. And we've had a great collaboration among health systems and our local health departments. We've been able to rapidly adopt best practices for the management of these patients through just information exchange. We have a lot of these kind of meetings every week. The Washtenaw County Health Department has hosted a meeting. So between U of M and us, we've been able to kind of share ideas, and it's been quite collaborative. We were one of the first sites in the state to start the remdesivir trial, which is one of the antiviral treatments that's now has shown to be effective. Also, the convalescent plasma, where patients who have recovered from COVID donate their plasma, and that is infused in patients who are acutely ill, as well as a steroid trial, the dexamethasone you guys may have heard about, that recently was published. We were an early adopter of that treatment, and so we're a large teaching hospital. We have a great research program, and so we were able to kind of integrate those kind of changes quickly. And I think that's been a great advance, and I think it will bode well for us in the future. Again, we were able to get some data from local emergency medicine systems, and there's definitely has been a rise in in-home deaths, not just attributable to COVID, but other medical processes. So can't emphasize enough to not delay care. Obviously, we think that we have to remain vigilant. Using masks, social distancing, hand washing. I should say, really, probably the biggest impact has been the way we've, as a culture, done a great job in isolating sick patients. Just as we have a containment unit here at St. Joe, I think the culture has in our community is, hey, if you're sick, don't go to work. If you're sick, stay home, isolate. That's really a change in behavior, and I think that had more to do with flattening the curve than almost any other intervention. Next slide. And this is just some our advertisement for how to access care here. We'll leave that with you. And then I think the next slide is this is one of our commercial spots that we're just trying to reach out to the community to remind them that safety is our paramount commitment. And I think that's all I have for you.
Well, thank you so much. We really appreciate your being here. Do you have just a couple more minutes to answer questions? I know we're getting right close to the 1 o'clock hour, but I do have a few that I would like to touch on if you don't mind.
Certainly.
Fantastic. We are seeing more cases of the COVID-19. You mentioned that was kind of nudging up a little bit. Is it because we're doing more testing, or is it just that it's present, and what should we do to plan and prevent a second surge?
So I would say it's not just more testing. While in the United States, clearly there's more testing. I think that you can some of the experts are pretty clear on this, that the percentage of positive tests is an important data point, not just the number of positive tests, but also the percentage or the number of hospitalizations. I think that's a very good apples to apples comparison about how things are going, because there's a point where you're sick enough that you need to seek medical attention and go to the hospital, and that you're deemed sick enough to be admitted to the hospital. That's a pretty constant. That's not a variable, kind of a assessment. And so watching that, I think, is the best measure. What we saw clearly is about a 2-week lull where we saw really no new cases, or just a couple new cases, and then now we've seen a handful of community-based cases. So I think that means that there's still some activity of the disease in the community, and maybe it's starting to show its ugly head again. It's a little too early for our community to make that call. I'm an optimist, and the last 2 days we haven't had a new admission, and so I'm hoping that it was a blip. But clearly some states are seeing a rise. Michigan has seen a slight rise since about last Monday, when we hit our lowest number of new cases in a day. So just over last week. So it's enough to get your attention. And what can you do? I think the same things. I think that this is my opinion, that we've probably reopened some of the things in the state at about a reasonable point. But as we're reopening, people are starting to relax a little bit. And so I think you can reopen and work safely. I think businesses should be reopened for sure. We should allow visitors, all of that stuff. But we have to be smart. And, if you're going to the store, you should wear a mask. If you're handling things, you should wash your hands frequently. If you're not feeling well, you should stay home. Those are really simple things. And I think that's if we did that, we'd be fine.
Okay, that's really good to know, because I think a lot of it is, you're right, it's sunny and it's warm out, we're all getting more casual, and it's hard to, want to put a mask on when it's
right.
when it's 85 degrees outside. So the second part of that question, it was actually another question, is was this nudge based on a natural correlation as the state continues to open businesses, which you kind of just got to. The last part of that point was, at what point would the state reconsider, at what point should the state consider reinstituting restrictions if the trend line goes back up? So if we do have a second surge and all of a sudden it starts really going back up, at what point do you think is the tipping point that the state should say, whoa, we got to slow back down?
Yeah, I mean, I'll leave that to the experts, you know, and the epidemiologists there. My sense is, yeah, if we see a big spike in hospitalizations again, I think that then we can be certain that this is a clear, you know, second wave, if you will, or a recurrent. And then I think you have to start, you know, considering at least backing off some. I will say, just to your point about masks, when you're outdoors and you're at a reasonable distance, I don't think there's a real compelling need to wear a mask. If you're walking on a jogging trail by yourself, driving in your car by yourself, riding a bicycle, I don't think a mask does a lot of good outside. In closed spaces or outside in gatherings, clearly it's a good idea.
Fantastic. Will St. Joe's be open to no reason COVID testing? Basically, not just because I have symptoms. If yes, what is the approximate timeline and cost to do so? I am somebody that will require periodic testing, such as every 2 weeks due to work requirements.
Yeah. So we have prioritized you know, our testing based on the Michigan Department of Health and Human Services recommendations. We have allowed that kind of testing of asymptomatic individuals in healthcare workers or high risk situations. We will only require a physician order for that. If there's a work reason, then we can accommodate that with a physician order. It would be the charge would be based on your insurance coverage, and I can't tell you what our charge is off the top of my head, but we can get that information and
Okay.
send it.
Fantastic. How can senior living communities best support the hospital? Are there protocols senior living communities follow when residents go to the hospital? Is there something that they can be doing to help make this process easier for everyone?
Yeah, you know, one of the issues early on, and it's clearly been a problem for many states, even in our local area. You know, you have a patient from a facility or a living, you know, a senior apartment facility or an assisted living facility who comes down with the illness, gets sick, and then is ready to be discharged. What do we do with it? And I think we spent a lot of our resources early on in buffeting the hospital with enough, you know, supplies and everything. And when I say we, I mean, you know, the whole community. And we probably, what we needed to do is think a little bit more carefully about how do we provide that same level of care and even higher level of care of the vulnerable seniors that live in these facilities. And so I think we've learned a lot about that. I think the same thing, isolating patients who are sick. You know, many nursing homes have developed wings where they put up the patients only in one place. And I think they've been very successful at that. Ones that didn't do that early had more difficulties. I think we want the other way the seniors can support the hospital is not being afraid of coming for care. We're here. Our whole mission is to take care of the whole community, and certainly, you know, the most common individuals who access hospital care are seniors, and I can say that as a we and not a they. And so, you know, we really we want to get their confidence back, and we want them to trust us with their care.
Okay. We just have two last quick questions. I think you answered most of the other questions throughout the course of your presentation. But one of them was, if you use volunteers to support your food and your distribution program, your farm, who should I contact to get the team involved?
I'm giving that one to Alonzo.
We have a farmer on our staff. Her name's Amanda Sweetman. So I can actually follow up and get some contact information and push that your way, Diane.
Okay.
And then we can make that connection through you. But Amanda Sweetman runs our farm. She coordinates everything on the farm. She coordinates community programs, summer camps, etc. So we're fortunate to have that resource with us. So I'll make that connection as we get off the phone.
That would be great. And what we will do is we will make sure that we push out all of this information back to those who have been on our call. We had almost 100. We had 99 on our call today, so we thank you. So we're going to take this last question, and then we will wrap it up. It said, you mentioned one of St. Joe's goals was to help at-risk communities.
Yeah.
Are there specific health inequities you were looking to address?
Great question. I don't want to presume that I understand the health equities that need to be addressed, which is actually kind of ties into the importance of actually having some focus groups out there to connect with some of those at-risk communities within some of our at-risk zip codes to better understand what they need from us. You know, we do a community health needs assessment each year or each couple of years, so we have a good framework from global data around what some of those inequities and issues are. But I personally think there might be other things that we need to be working with and collaborating around to help some of our at-risk zip codes. And I'm interested in sitting down and having some conversations in a way that we can actually establish a level of trust with some of those community members. And then we can have some open-ended dialogue around how St. Joe's can better help folks within that community.
Okay, that's fantastic. I'm sure that there are a lot of individuals willing to help you gather and garner that information to have that dialogue. It's very important in our community, so we appreciate that. President Lewis, any final words you would like to leave with us today?
No, I look forward to just, maybe doing these on a semi-routine basis, just to make sure we're able to kind of convey to you what we're working on, and we're able to have some two-way dialogue around how we can actually better collaborate, in the business community. So I look forward to continuing the dialogue, and I just want to further state that St. Joe's is committed to being that transforming, healing presence, and it's we are operating in a very safe manner today, and it is very safe for you to actually come seek care. So please don't put it off. Call your doctor and get treated for what you might need, and we're here to help with whatever that doctor might say you want to get more evaluated with. So thank you.
So thank you. We want to take this moment to just thank Dr. Vandenberg, President Lewis. Thank you so much for your time. The partnership that we have with St. Joe is amazing. We appreciate this dialogue and the fact that you would be willing to come back and help share again your expertise with our business community in order to help us, get to the next level of assistance and care and community as we pull all of us together during this unusual 2020. So with that, I would like to say thank you to everybody who joined us, and especially thank you to our guests and Laura, who also helped coordinate, and my team. Thank you so much. Have a great day, everyone.
Thank you, Diane.
Thank you. Bye-bye.